Hi, good afternoon. This is Leilani Doyle with Senior Site Care, and I want to welcome everyone to our first webinar presentation. We're so glad to have you on the call. I see that we have a number of folks attending, and we appreciate your attendance there. I think it's very important that we continue this innovation series and use it as a method for delivering good information out to the nursing homes that we are serving. We've all been impacted by the crisis, and sometimes that leads to a feeling of isolation. So we're hopeful that this webinar gives you a break from that and helps you learn a little bit about what's going on in the market. I'm Leilani Doyle. I'm the Director of Education and Awareness for Senior Site Care, and I'm joined today by some of our very experienced leaders at Senior Site Care. I have Dr. Elizabeth Klepper, who is a board-certified psychologist with a specialty in neuropsychology. She's also a regional director in the Dallas area, and she'll be joining us to give some perspectives from the therapy perspective and a broader view of crisis. And Dr. Klepper, would you like to say hello to our attendees?
Hello, everyone. I'm Dr. Klepper. Leilani, thank you for the introduction, and thank all of you for taking time out of your schedule to attend this webinar.
Wonderful, wonderful. And then also, many of you may know Kendall Reese. She's a psychiatric nurse practitioner, also in the Dallas region, has extensive experience and has maintained day-to-day contact with facilities throughout the crisis. She comes to us by way of sharing what's really going on in homes and being able to relay some of the impacts there. So Kendall, would you like to say a brief hello to our attendees?
Hello, everyone. I'm glad to be part of this panel and looking forward to it. Thank you.
Awesome, awesome. And then there's Tom Forsberg, who is the regional director in our South Texas region. He is a licensed administrator, which is a tough position to hold, and has participated in long-term care throughout the Texas area. So Tom, would you like to say just a brief introduction?
Absolutely. Thank you, Leilani, for the introduction. And my name is Tom Forsberg, and I'll be talking this afternoon. My section is going to be on our electronic device that we have modified for our telemedicine, and I'll be briefly discussing financials.
Thank you so much for that, Tom. What I would start, and we've recognized our panelists, I've introduced myself, but I want to give a moment to recognize our attendees here who represent facilities throughout the state of Texas. And we understand that there is no greater honor than to care for the very young or the very old and those that can't care for themselves. And we know that honor is something that you're carrying through in your day-to-day mission. And that is our mission as well at SPC Health and Senior Site Care. We want to create a better quality of life for you, for our patients, and for your families, both out of the patients and of the staff. So know that we really care, and that's part of the reason why we're delivering this innovation series webinar. And just to get things out on the table, we know the impact of COVID on nursing homes has been extensive and the subject of great focus, and nowhere is it focused more on than the red states and California and Texas. You all feel it day to day. We feel it as we're in homes and facilities day in and day out. And we understand that impact creates a great deal of stress and uncertainty. So today we want to give you some tips that will help you bridge that stress, help you alleviate some of that and shift it into maybe some more positive direction and energy levels that you can achieve, and then learn about what's happening in terms of a broader support system that helps deliver consistent care and potentially increase your revenue opportunities from a facility standpoint if you happen to be an administrator there. And since I'm not an expert in dealing with stress and fear and all those things that come with it, and Dr. Klepper, I thought I would call on you to to give us just a little introduction or some background from a clinical perspective about what's going through with the facilities, with the providers, with their families and patients.
Unfortunately, stress and fear are emotions we've become more than acquainted with since the beginning of this pandemic. And I, for one, have asked myself so many times, since it began, why is it that I'm seemingly sleeping enough and I'm so fatigued? And so I think to really understand that, we have to look at how our bodies and our minds are wired. And so we could start with the amygdala. That's the fear center of our brain. And it's continually scanning, our surroundings and environment for signs of danger. When it detects danger, as we know, it kicks into a fight or flight reaction. And this reaction is most conducive to an immediate threat. The fact that we've been exposed to prolonged trauma has made it where our brains cannot naturally reestablish a state of calm. So even day-to-day tasks can seem very daunting.
Yes, I agree. That is certainly something that we can all relate to. And if we were to think through how we might be able to adapt to that change or take some action that would direct that energy more positively, do you have some thoughts in that regard?
That's an interesting question, because I think many of us want to stop hurting, and some of us want to make the change and want to do what it takes to change, and then others are slower to adapt. So change occurs when you become so uncomfortable with your situation that you just don't have a choice. And the strongest indicator of survival is our ability to accept change. So I would say cut yourself some slack. Understand that this is very personal, and establish realistic goals and expectations. You and I talked about the routine that my husband and I set in place. We decided that watching the news and social media were not necessarily healthy for us. So we reduced the number of times we watched the news and got on social media to once a week. We decided to eat together, to really watch what we put into our bodies, and to, at least, if nothing else, take a walk around, get outside, get some sunlight, for a second or two. And we've allowed ourselves, a certain portion of the day to mourn, because grief is going to be an inevitable process.
Great. As we're thinking about our ability to adapt change, which is the best predictor of success, I believe that was the messaging that you were talking through, Dr. Klepper. What are some of the items? And I put together a list of items that I've heard from the field and working with folks across the state of Texas, but maybe you can go through some of those changes that you're seeing that we've made internally at Senior Site Care, and those that are being made externally at the facilities within their operations.
So some of the things that we've done to adapt to our new normal are things, for example, like PPE, just wearing the gloves, the face shields, the masks, sometimes the gowns, and the physical distancing. Our providers are tested regularly for COVID-19, and they are tested each, I think it's every 40-something days, and then they produce those tests to HR. And in the event that they are exposed to, or believe they're exposed to COVID, they have additional tests. And most of them have a 24-hour turnaround. So that's been very nice and gives, the facility some comfort that we're taking this very seriously and that we're doing everything we can to protect our providers, the patients, and the nursing home staff. And I think another thing that we've done to adapt to the change is to add telemedicine. Obviously, nothing replaces face-to-face, but certainly in times of crises or crisis, the telemed has been very beneficial for us and has allowed us to continue to provide quality care to the patient.
Yeah, excellent. And certainly those safety protocols is something that everyone's having to adapt to across the country, and hopefully some good outcomes behind that. The other thing that I've heard is the ability to establish updated routines, so that we all had routines prior to this crisis, But what kind of updates to daily routines or new routines are you seeing within your practice area?
Do you want Kendall to take that one since she's in the nursing home?
Great.
Okay. Yes, when COVID hit and everyone had to maintain distance, all group activities and family visits were stopped, that deprived the patient of some self-directed coping strategies that they could just avail themselves of when they felt stressed, or it helped them track the day. It gave them a routine that's very predictable, and routine is very comforting to most people. They've had to adapt to new routines, and I stress to the places that I go that it doesn't matter that things have changed. If you can just reestablish the new routine so that it can be as predictable as possible, so that their stress level stays low, and that doesn't, and then that helps the staff stress level stay more manageable, because the more patients are stressed, staff are stressed, that in return re-stresses the patients. And then it also increases the patient's dependence on staff for emotional support, activities of daily living, news, all kinds of things. Keeping the patients as calm and moving forward as possible, that's better for everybody. It makes everybody's life better.
Agreed. And it is hard to replace bingo nights, or dominoes, or whatever their next activity is planned. But just being able to have that sense that you've got a provider or a set routine does seem to have proven results in that. In terms of enhancing staff and Outlook facility information, it does seem to go hand in hand with that.
Yes, because the patients look to the staff for guidance. So they're watching what the staff are doing to know what they should do, because some people are very confused, or they may be delusional, or whatever. So when they see what the staff are doing, wearing a mask, washing their hands, reminding them to wear a mask, wash their hands, stay apart from other people, then that gives them a more comfort.
It gives them someone to follow, and they see that, oh, this is normal.
Yes, yes, exactly.
This is working out. I imagine it's got to have a pretty significant clinical impact, because I know that the THCA reported 55% of all nursing home residents were depressed prior to the COVID crisis. This is a report that came out in late 2019, and I'm only going to imagine that this has impacted the number of the need.
Yes, yes.
Care is hard, to say the least.
Yeah, when they don't know what's going on, they may be worried about family members in the community. They're worried about themselves getting sick. Just not knowing what's going on is really frightening. So anything that can be done to help just distract them and give them some sense of purpose for the day is really, really helpful, is what I have found.
And so, Kendall, I know you've been present in several facilities throughout the crisis. I know you have your protective equipment in there. Is there anything unique that you're seeing when you're visiting your patients? Are they adjusting to the new safety protocols or the use of telemedicine? Is it becoming a bit more comfortable for the patients and the staff?
Yeah, they're getting used to the masks. Still, it need to be reminded, but they're responsive to being reminded, because they do forget. But they see the staff wearing them, and we just kind of gesture or say, oh, remind you to cover your face. There are some that are completely non-compliant, and we just have to work gently with them to just keep them as protected as we can. But that's going to be in every facility. So if the majority are being compliant, and we help them understand why others might not be, without revealing anything. But I haven't seen any of my patients get mad at another patient for not following protocol or whatever. They seem to understand that it's a hard thing to remember to do. I'm not seeing a lot of difficult interaction with them, reminding them to wash their hands. At one facility I go to, they have the person who usually would do their manicures. They go around every day and just do a really good hand sanitizing session with them. And they get a little bit of tactile stimulation, a little hand rub, but their hands are cleaned very, very thoroughly every day. And so that reminds them, wash your hands. And I make sure that I model that and say, oh, I picked this up off the floor for you. I'm going to wash my hands really good. And I show them that I'm doing that too, so they can feel secure that the people that are taking care of them are doing the best that we can to protect them. And I remind them every time I see them, we're in this together. We've got to protect each other. And then if they are still struggling, I'll ask them, when not if, but when you've faced hard times before, tell me about how you coped with that. What was that like for you? I want some inspiration myself. And I have found that to be very effective, just to remind them that this is not the first difficult thing that's happened in your life. And, let's draw on some of that strength that you already have. And that I found that quite helpful.
That's really right. And I think that the story about the hand sanitizer from the former manicurist, that's a great way to identify a new routine, something that they come to appreciate and have that outreach there.
Yeah.
Dr. Klepper, in terms of, the collaborative care model, I know that Kendall comes really from a more of a psychiatric nurse practitioner, and very often dealing with her, visiting her patients. The unique factor that senior site care brings to this market, and one that is very responsive in this crisis situation, is the whole collaborative care system and theory that senior site care really put on the map a few years back. So maybe you can share a little bit about that collaborative care model and what's entailed in that and why it's different.
Part of what makes us different is that our teams are highly specialized. We've got the board certified geriatric psychiatrists, psychiatric nurse practitioners, licensed psychologists, and then the LCSWs. The psychiatrists on staff not only provide collaboration or supervision for the mid-levels, but also they evaluate and actively treat the patients. Our goal is to treat the patients holistically, and we practice a model that encourages continuity of care rather than a triage approach. So we understand the importance of successful GDRs. We work together to exhaust all means, especially the therapists work together to exhaust all means before we resort to medication. For a number of years, actually, Kendall and I worked in the field several days a week at the same facility. We knew the patients inside and out and the staff. We were able to participate in meetings with the PCP, the social worker, the DON, the administrator, sometimes even the pharmacist, and others who are involved in the patient's treatment. So we call that process behavioral rounds. In that meeting, we discussed, state and national averages so that we could make sure that our GDRs were where they needed to be. We also discussed aspects such as hospitalizations and all that nature. In addition, we screen our patients upon intake, the patients on our caseload, for depression and cognitive impairment. We're able to communicate our findings with the staff and also to set measurable goals for the treatment, as far as the longevity and the frequency go. The patients don't always present the same way across providers. So we look for meaningful inconsistencies and ways that we can provide integrated treatment. And I think part of the reason Kendall and I were so successful is because we made that home and those patients our weekly priority. When we hear from dissatisfied facilities interested in our psych and therapy services, one of the things that I hear is that they need services more than just once a month. So much can happen day to day, even minute to minute. That coupled with, the addition of telemed services. Telemedicine, like I said before, never replaces face-to-face. Rather, it adds another layer of sophistication to that integrated and collaborative treatment approach.
Yes, I agree, Dr. Klepper. And one of the things, if you're talking about that regularity of visits and how that has affected patient outcome and improved staff facility atmosphere, having telemedicine clearly at the time of COVID was critically important. And it's so good that Senior Site Care was a leader in that, having adopted it more than 2 years ago and having it used to support rural communities or urgent care needs. In fact, Senior Site Care has had telemedicine successfully adopted by 45% of our contracted facilities. And some of that gets delivered through available technology. That's how we started, through cell phones, through existing computer equipment, and some evolutions of computer equipment. But with the event of COVID, Our team adapted really quickly. We adapted to that change and introduced SAM. SAM is our senior access machine. It is a portable kiosk that is equipped to be moved from room to room, and it takes the place of using the cell phones and other devices that might be tied or more cumbersome for facilities to use. And I will just show you show you Sam, and then let Tom talk a little bit about his experience in implementing that in South Texas, since I've had Tom on the call and he hasn't had a chance to say anything but hello. So this is Sam. He's portable, secure, and easy. He gives you immediate access to providers and is implemented by senior site care trained staff.
2 years ago, we started doing telemedicine, and the machine was on a hard metal box, something that maybe in the nursing homes, an activity director would roll up one of those old antiquated TVs on the very top shelf, and maybe the movies were in a lock box below. That's how it started. What you're looking at now is our third prototype. Its design is extremely streamlined. Basically, because of the ergonomics and the customer feedback is what we've got, is why we made the changes. Notice the IV pole. The SAM is a tablet that's mounted on an IV pole, very easy to roll down the hall, and it stores in a small space. It can be adjusted vertically, horizontally, and the head rotates to accommodate any sitting or lying position. So a patient or a resident can be lying flat in bed and still have a face-to-face visit with the professional that's talking to them. A couple of things I'd like to point out. We've added speakers for extra volume, and that was as a result of some of our customer feedback. And the battery life in the tablet runs about 4 hours, and it can be plugged into any outlet, which is nice. We use Microsoft Teams as our platform. Microsoft Teams is HIPAA approved, so that's very, very nice for the nursing home. It's very nice for us. When we install it in the facility, we log on to the facility Wi-Fi, and our device is programmed to only accommodate Teams. This helps eliminate the staff or residents surfing the web and using the facility's bandwidth. So yeah, very nice, very, very up to date, very secure device.
I'm so glad you're able to see Sam and meet Sam behind this. It is in use, and we've got SAMs deployed in all regions throughout the state of Texas, and we're conducting hundreds of visits every week as SAM to augment the regular face-to-face types of visits. And how long does it take to get one out into a facility from the time that it's requested?
We've been successful at about 4 weeks. We do have a supply right now, a small supply. So if a new customer comes on and would request one, we can get it out there relatively quickly. But when we first started this, it took about 4 to 6 weeks was the backlog, but we've caught up on the backlog, and we can deploy them relatively quickly.
Wonderful, wonderful. One of the aspects that I thought was impactful for you to join this session for was to discuss ways that nursing home facilities and other long-term care facilities can help improve their bottom lines, because we all know they're experiencing a lot of cost related to the COVID, buying additional equipment, and many of them are struggling as it is. So any tips that can help improve the bottom line from your perspective as a former administrator would be, I think, hugely helpful for our audience.
Absolutely. One of the ways of making money is not losing money. And by not losing money is reducing our discharge or hospitalization rate. And by reducing that hospitalization rate, especially in nowadays, guess where all the COVID patients are going? To the hospital. So if I'm a nursing home administrator, I really don't want to send somebody unless I absolutely have to. But if I can treat the patients in-house, that is the best. So by reducing the hospitalization rate, I'm actually making money. Actually, when I was a regional out in the Lubbock area, Just a quick story. I had 3 properties, and we specialized in admitting people that were being discharged primarily for inappropriate behaviors in other nursing homes. And so I had, in one of my properties, I had anywhere from 100 to 110 patients that had is a behavior unit is what the nursing home specialized in. And my current provider, when I came on board with that group, was they came out to the property once a month for psychiatric services. They were the only game in town. So when senior psych care approached me, I was very hesitant on changing, because if they didn't work out for me, I was going to be in a real pickle. Senior psych came out. They implemented a weekly visitation. And here's what happened. When they implemented the weekly visitation, I noticed that my discharge rates dropped significantly. I was discharging on the average of 4 a month, or basically 1 a week, prior to senior psych care coming on board on this particular property. And within 3 months, it went from 1 a week to 1 a month. Now, keep in mind, we took people that no one else wanted in their facility. So I had over 100 residents of behaviors, but from going from 4 discharges a month to the psych hospital to 1 discharge a month was huge. So that was a great success story for senior psych care. I was very impressed with their model.
Wonderful, wonderful. And I guess you were so impressed, you joined the team.
I did. And another thing that was implemented in the last couple of years was our Dr. Klepper had referred to the gradual dose reductions. That's something that's mandated by the state. We don't call them dose reduction rounds. We call them behavior rounds, because when they're dose reduction rounds, that kind of leads to a meeting that is facility driven for facility purposes and facility gain. When we're doing behavior rounds, and which is basically a dose reduction round, we're focused on the resident and not the facility's needs, but the resident's needs. So we do behavior rounds. Some facilities want them once a week, or once a month, I'm sorry. Some facilities want them once a quarter, but we document them, and then that way that the nursing home has that evidence of dose reductions when the state asks for that on their annual survey, or if it's ever in question on a complaint survey. And when they produce those records, that they avoid deficiencies. And when you avoid deficiencies, that ties into your key performance indicators, and it also ties into your 5-star rating. A lot of people right now are looking at that 5-star rating even before they come and tour the property, to even see if the facility is going to be a candidate for their loved one.
Yeah, isn't that the truth? With the internet, that's the first place you turn to, and you want to make sure that your facility is there and viewed in the proper light. So I'm so thrilled that we're able to help facilities in attaining that goal and maintaining it. The other piece that I thought might be interesting for you to cover, the delivery of telemedicine. We have the SAM. It is very easy to move from room to room, sanitize as needed between visits. We have a protocol for that, but it does take some staff time to do it, and some cooperation there. So there is an opportunity to recover some of that staff time cost in an origination fee. And Tom, would you elaborate a little bit more on that origination fee?
Yeah, I'd love to. I get excited on this because the origination fee is done at the facility, and it's per visit. And we have a tutorial that we supply our clients for either the MDS nurse or whoever does the ancillary billing for the nursing home. But an average, now some of the visits might be $17, some of them might be $24, depending on the contract. And there's literally hundreds of contracts out there, depending on the facility location, depending on which payer source it is, whether it's an insurance company or Medicare, Medicaid. But the average, I'm just going to work on an average of $20 per visit. And our company did roughly 900 visits let's say last week, if we did 900 visits, that's $18,000 collectively. Now this is across the state of Texas and all the properties. $18,000 of what I call low-hanging fruit, and all the nursing homes have to do is bill for that and collect it. And let's say an average nursing home does 50 visits in a week. Well, you take that 50 visits times $20, and that's $1,000 in a week. Well, it's pretty easy to calculate the annual revenue on that. And that's just for efforts that's currently being done. And I've been in nursing homes where, you know, making a profit and losing a profit, I mean, $4,000 could make me or break me as far as either bonus or even maintaining employment. Some administrators get fired if they start losing money consistently. So this is an avenue for, in addition to reduction in hospital discharges, this is actual money to the bottom line.
That is wonderful. And I know that we have reporting capabilities so that we can help provide some estimates for your facility about what that might look like. I'm not saying that telemedicine is ever going to replace face-to-face, but as a solid augmentation during COVID and going forward in the future. If you have schedules that you need to meet or need some specialized services based on our collaborative care model, it's something that certainly will carry on in the future. It is not going away. It was responsive during COVID, but is clearly a trend in the healthcare industry. So senior site care can help you estimate that and actually help deliver some reporting to whoever does that kind of billing. It might be your corporate headquarters or whatnot. We're happy to work with you, and you can relay that information up to your senior site care representative about who might be interested in that information there. So,
Lonnie, there's one more area that facility administrators and regionals would be interested to hear that, and that's the when a resident comes up on their 14-day look back period, if they have 2 clinical visits, that will actually enhance their MDS rate, and that MDS rate can go up to 90 days into the future. So with our model, that also helps with their financial bottom line.
wonderful, wonderful. Thank you for bringing that to my attention there. So I know we're running a bit short of time. I do want to thank everyone for hanging in there with us and being patient. I appreciate all your consideration. As Senior Site Care is here to help, and we want you to feel free to reach out to our SPC Cares hotline, which is at the number listed on the slide, 346-223-1602. That hotline is answered during business hours, but calls will be returned or answered then or returned within 24 hours. Or you can send email to spccares@spchealth.com. We have a solid service level commitment about assigning practitioners within 48 hours. And anyone that attended the webinar gets immediate access, priority access to a SAM. If you're needing this, just reference the webinar and you'll be put on that priority list. So I want to again thank everyone on the line for your attendance and patience. But if you have questions that you need to have answered, feel free to reach out to the SPC Cares email or to your regular senior site care healthcare professional. All right. Well, thank you all so much. We'll be having our next webinar on September 30th. More information will be coming. If you enjoyed it, please share this information with your friends. If you have feedback about how we can make things better, please send us the feedback also. We're here to take that. Dr. Klepper, thank you so much.
Thank you. Thank you guys for attending. We appreciate it.
Kendall, thank you for your
Thank you very much. I appreciate it.
and Tom, thank you for wrapping things up so nice and neat and giving us a business side to this aspect.
And thank you, and our thoughts and prayers to our brothers and sisters on the coast.
You got it.